Well, let's start. Just tell us a little bit about the Creating Hope Together strategy itself and what that's all about, the sort of long-term picture.
Well, I think the way to sort of summarise what Creating Hope Together in the long-term strategy is about is taking a whole of society approach to suicide prevention, recognising, yes, the importance of intervention and the services that can deliver those interventions, but also that wider piece on the preventative agenda. And by taking that whole of society approach, looking at the environment in which people are living in, quite literally, but the built environment, but the social, cultural and economic environment and how that impacts upon risk of suicide, recognising the elevated risk of suicide amongst groups in more deprived communities, and also in terms of responding to that, building that collaborative approach across the systems that provide intervention, but also in terms of trying to affect that wider societal change so that we create a culture and a society where we tackle issues around stigma and create that space for those conversations which can be quite literally life-saving.
Yeah, I think Tom's covered a lot of points there. I mean, Creating Hope Together and the suicide prevention strategy is about making sure it is all of society. It's not just national and local government, it's all the various partners, it's all of us as individuals, and taking down that stigma and open up to have those conversations that can support people and make a big difference. And I think we've come quite far. You know, we now have an organisation, Suicide Prevention Scotland, a national level that goes down to a local level, when we see excellent examples of suicide prevention work all across the country, and that's making a huge difference to so many individuals, giving them that support, but also giving training for others to give them the confidence to have those conversations. It can be difficult at times, and that can make a huge difference. So I think that's all coming. We're here today for the second action plan, you know, so it's really significant that we're doing that. And as I say, it's not just national, local government, it's every part of society working together around suicide prevention.
Just before we come to the next action plan, if we just take a moment to think back of the last 3 years of the first action plan of this strategy, it's very difficult to talk about successes in suicide prevention because every life lost is a tragedy and it's a failure. But when we look at that for those people who are working every day in this space, day in, day out, there have been some positives over that period. What would you both reflect on in terms of the successes, if we can call them that?
Probably there has been many positives. I think the positives are that, you know, we're having this conversation all across Scotland. We're having it at a national level, we're having it at a local level, we're having it in our communities, and that's so important. And that work is making a difference. But as you say, you know, there was still 704 deaths by suicide last year, impacting individuals, communities, families, friends, and it's devastating, the consequences of that. So we're absolutely committed to doing more and going further to break down those barriers and give people the right support in the right place all across society. But the last 3 years we were on a journey, you know, with the establishment of Suicide Prevention Scotland, the action plan, the work that's going on at a local level all across the country, whether that's through local government and partners, national government, or whether it's third sector organisations. There's wonderful examples of the excellent work they do as well to support people.
I'd broadly echo that. I think a lot of what has been achieved over the last few years is helping to build those collaborative approaches and that infrastructure. And I think there's an opportunity to intensify and deepen that work over the lifetime of the new action plan. And I think that will continue to yield, you know, positive results, while of course recognising that every life lost to suicide is a tragedy. I think we can see progress being made, and I think we've got a real opportunity, as I say, through this action plan to deepen and intensify that work.
So let's take a look at the new action plan then. What for you both are the key priorities?
Yeah, well, look, there's a range of areas. I think a particular focus on intensifying work around those who are most at risk is extremely important, recognising as we do the correlation between risk and deprivation. There's also that commitment in strengthening work on children and young people, including those who are care experienced and those who are neurodivergent. So I think these are really important pieces of work that we can take forward as part of the action plan. It builds on the work that has been already undertaken, but I think there's an opportunity to bring a particular focus to these areas through the lifetime of the new action plan.
So, and Tom's covered the key areas, but I think it's really important we build on the previous action plan. And what I think is critical to this action plan is that this is driven by those with lived experience. So the various groups that work through Suicide Prevention Scotland and the Creating Hope Together strategy. So it is young people and children who are feeding in their experiences into this action plan, staff, people who are supporting those services feeding into it, and those with that lived experience. And they are the critical voices that have driven this plan. It's also critical we keep the sort of themes around inequalities and the impact it has, in terms of the more significant impact in some areas, in terms of the suicide rates, in terms of with areas of deprivation, and that we need to work intensely in those areas to give people the support they need. So that's all part of the plan, and I think it's really important that the plan's also driven at a local level, and we're seeing local plans following some of the stuff within the action plan, which is really, really important.
And just on that point of lived experience, you heard this morning from a couple of people, one of whom, Elaine, is going to talk to us shortly. Sometimes working with people who have that lived experience is probably a little bit uncomfortable as well, but I would imagine you're going to see incredibly important.
Absolutely, and I'd want to convey my deepest thanks to those with lived experience who have contributed in so many ways to the development of the strategy, the previous action plan, and this action plan. Lived experience is so important, and it has to permeate everything that we do across all areas of policy. But in an area such as this, it has the ability to ensure that our focuses and our aims are concentrated on what can be most effective, and also the way in which we design services and interventions that we learn from perhaps where things in the past have not worked as we would want. So we have an opportunity to build from that experience and ensure that the services that people receive are not just timely and of a high quality, but are compassionate as well and person-centred. And being able to achieve that is only possible thanks to those with lived experience who bring their expertise from experience to bear on the work in developing the action plan.
The next phase of the National Suicide Prevention Public Awareness Campaign will go live in a few weeks' time. It's been co-produced as well with people with lived and living experience. I'm just interested on your reflections. Last year we saw that there was a statistically relevant increase in people's confidence to talk about suicide by 8%. And just your own reflections on the fact that we appear to be moving in a direction where people are slowly getting a little bit less frightened to talk about this.
I think that's a really vital part of the work is the campaigns we're doing at a national level, and certainly I think there's been a raised awareness of suicide prevention and having those conversations, and that's what this is about. It's about breaking down those stigmas. These campaigns are vital and pinpointing people to have the conversations or to offer people support in very, very difficult times, and that's what this work really is critical, that we all do it. We're all part of our communities, and we need to, if we can, give people support through some of the most difficult periods, and that's driven obviously by lived experience. So these campaigns, and the What If campaign that's launching in February is vitally important, and you've already seen the work that's been done previously, and the podcasts and other areas of really excellent work that's raising that awareness, breaking down the stigma, and making sure we can all play a part in supporting people as best we can.
Yeah. I think we can see this in a broader context as well of the progress we've made overall in talking about mental well-being and mental health, and the greater awareness and willingness for people to seek help and support informally and formally through services. And that is very positive, and of course it's incumbent upon local, national government working collaboratively with other partners to ensure that we can meet the need for those services to respond to people who are seeking support. But I think we also have to recognise that there's still a lot of work to do, and that stigma is still a particular challenge, and also we know we face particular challenges ensuring that we can get the most timely support and that early intervention to specific groups. So I think there's an opportunity to build upon the work of previous action plans as well as wider work on mental well-being and mental health, and that's a real opportunity we can take forward through this new action plan.
Probably the harder bit of this is as we encourage more people to talk and to seek help, it puts further pressure on systems which are already under an enormous amount of strain. How do we ensure that people who need that support get it and get it quickly?
Yeah. I think it's been having the widest range of partners involved in taking that collaborative approach, and that approach of partnership is right at the heart of this strategy with Scottish Government, with local authorities through COSLA, and the wide range of organisations all over Scotland who contribute towards that wider work around suicide prevention and awareness. So it takes a wide partnership approach. There's of course a role for statutory services within the mental health system, but there's also that important role for those charities, third sector organisations who can provide a range of interventions within local communities. So it's having that wide range of services to respond to the needs of the population.
I was going to say, just I suppose the challenge on that is if you're a member of the public and you're in that stressful situation, it's a bit, where do you go? It's fantastic to have those partnerships together, but you know, what advice can we give to people in that sort of space?
That's critical, isn't it? I mean, and I think well, first of all, have to thank the many people that work in suicide prevention, you know, whether they're voluntary or whether they're employed to, you know, they go above and beyond to drive this forward and make sure people get support. But it's critical that we're able to signpost people. So part of that is obviously having these national campaigns, having a national organisation looking at it. Part of it's having these local high-profile campaigns to say, look, there is support there for you. But the critical part is for all of us. It's for us to be able to say that, you know, we're there to give support to people. We can be, you know, people can get suicide prevention training, etc. But to have the not to be afraid to have a conversation with someone that are struggling, and whether that's pinpointing them to professional services or whether that's pinpointing them to fantastic third sector organisations who absolutely play a vital role in offering support to people through that suicide prevention work.